Hi, my name is Harry Radcliffe. Thank you for listening to my presentation, which is on living with EDS and GI issues. As said, my name is Harry. I'm 38 years old. I was first diagnosed with EDS when I was 17, again in my 20s, and again when I was 30 years old. It was actually when I was 30 that everything decided to deteriorate quite rapidly. And as a result, my life has changed dramatically. On top of that, I now, as a result, have a carer who comes throughout the day to do everything for me, from getting me in and out of bed, undressing me, dressing me, washing me, getting my feeds, managing my pills, you name it, he does it for me. So it's a pretty drastic change from the independent person I was before, and you'll see more about why. So what symptoms do I have with my EDS? The first is gastro and intestinal. I have an incredibly slow digestive system from the esophagus down to the jejunum. I have gastroparesis within the stomach, which is probably the most complicated aspect to it. And I have bile reflux as well, which can cause some complications. I have some colorectal issues, which we'll also get to. I have multiple joint subluxations, and as a result, pain management issues. And just finally, I have functional neurological disorders as well. So, first of all, gastrointestinal issues. It started when I began vomiting food and then could not keep any food down. I was put on supplement drinks by my GP, and in the process was vomiting them up. I lost about 5.5 stone in weight. I've actually lost a bit more since. I'd vomit daily, water sometimes, and occasionally anything else, even too much gunk or phlegm. So it was an incredibly difficult time. I ended up in hospital with dehydration, temporary kidney problems, low sodium, low potassium, kind of low blood levels as a result of that. I still was hugely affected by nausea. And just so you know, in preparation for the other slides, I am still vomiting and still having these challenges. A part of it I want to discuss is the mental health side. Having gastroparesis in particular is hugely anxiety riding. It causes a lot of fear about maintaining weight, keeping weight, losing weight, and how we're going to do so successfully. At one point, it caused such malnourishment that I had alopecia and lost a lot of hair. And on top of that, had sores all across my body, which required quite painful treatment, and the mental health challenges that come with that. As you can imagine, it's a big challenge to try and overcome these when you're fighting such a hard battle. So challenges with treatment has actually been the biggest issue and probably the hardest thing I'm dealing with my EDS right now. I vomited supplement drinks up daily, and we realised that wasn't the way forward. So we went to an NG tube where I continued to vomit the feed up daily and the tube up so many times that they realised it was not worth trying again. So we went on to the NJ tube. I continued to vomit consistently daily, whether it was just anything in my stomach, small through to water, as well as attempted the feed from down in the jejunum, which caused significant agony, and would often cause me to cry. And I lost just under another stone in the 2.5 year period. I'd vomit the tube up at least once a month, if not more. And it got to the point where I just couldn't handle it anymore. So what we're trying now is partially pre-digested drinks. It's mixed results, but slightly more positive. I'll vomit one up a day. But sadly, there are days where I'll vomit them all up. Last week, for example, I had 3.5 days where not one drink would stay down. And I know I've lost weight from that, but hopefully this week I'll be able to put some back on by continuing my drinks. But it's unstable, and that's a big concern to me, because my weight is still very low. I'm now near the loss of 6 stone, so I need to find a way to get stability, and there doesn't seem to be anything out there. They've suggested the peg J, but the problem is they think my EDS is so severe down there that the peg J would cause the abdominal wall to collapse, and then I'd have quite complex issues. Colorectal issues, I have severe constipation challenges and serious pain that comes with the colon. The treatment to date is predominantly medication in the form of Picolact, which is the strongest laxative you can get in the UK. Sadly, that's not always successful. I also use the Peristine, which there's an image of there. It's a bit like an enema. However, you hold the water in your colon through a balloon, a bit like a catheter, and it keeps the water there and tries to empty the colon out more. That again is mixed success, and I do have challenges, and I've been hospitalized many times because of the constipation. How does it affect me in terms of subluxations? I will sublux multiple times weekly. This is all the key joints, in particular the hips, but also very much the knees, the shoulders, the shoulder blades, the fingers, and the ankles are now the next thing that are starting to worry me. I've had a lot of falls because of the hips, just transferring from my chair to the mobility scooter. This has resulted in numerous concussions, hospital visits, secondary injuries such as the neck from falling or landing and dislocating another part of my body in the process when I hit the floor. So it's incredibly challenging. As a result, I'm totally immobile and require a mobility scooter both inside and outside the house. So my life is incredibly limited. It's a big challenge when you have subluxations because you go to hospital, and generally I'm quite resistant to pain medication, which we will get to. However, the hospital will not be able to do enough and will generally leave you for hours before you're seen to in the first place. Treatment methods. I've got a huge number of tools around the house. I've got a stair lift and a hoist to get me in and out of bed. I've got a riser recliner toilet, which is very near to where I sit. I've got rails and ramps where possible, but really I am immobile throughout the day. I don't transfer unless someone is there in case I fall. I have the top physio for EDS in the country. He's amazing. At this point, I can't do any physio because even without resistance bands, the physio is just too painful and too much. And rheumatology and orthopedics, who I'm under, can only provide so much advice and not so much treatment. We've tried multiple braces. There's one brace that works to stop the knees subluxing. Bar that, there is nothing out there for the other joints except the fingers. So that's something which could really help make someone's life easier. As a result of all these subluxations, obviously have chronic pain. Pain is totally debilitating, stops me resting, sleeping, and even being able to go on my mobility scooter. So I'm very housebound most of the time, and we're not able to get away for a walk or anything a lot of the time. We have a dog we try to walk every day. Pain is normally the result of either subluxations, flare-ups, or just general joint pain. It's incredibly frustrating. With the hips, when they flare up, it flares up the bladder, the insertion point of my catheter, my urethra, and my prostate, because I have chronic prostatitis. And as a result, we've required ambulance or hospital assistance, but again, without their understanding of EDS, their pain relief is not enough. Even IV morphine, they limit at a lower amount than I need to. I've seen 2 pain management consultants. I have my rheumatologist and orthopedic specialist as well. However, we tried everything possible. We tried everything non-opioid driven. I've had ketamine infusions. I've had lidocaine infusions. I've tried every opioid. So IV morphine, I need at least 35 mils before anything will happen. Outside of that, Oromorph, Oxy, codeine and fentanyl do nothing. There needs to be a better solution to this pain because it's not neuropathic. The bladder and prostate were actually the first things to go when my EDS began. I started retaining a huge amount of urine, which would leak through my urethra and cause absolute agony. I had a number of tests done. I got consistent infections, and as a result, also got chronic prostatitis. We went from, in terms of treatment options, from using self-catheters, but it was to the point where I was using them 14 times a day. So we moved to a urethral catheter and then a suprapubic catheter, which I have now. That's proving successful. However, the last 5 or 6 of them, so maybe nearly 2 years, I've had complications with them actually working properly. So my bladder is actually getting investigated further on top of that medication to help as well. Functional neurological disorders, my cognitive ability is stretched with both verbal communication, reading, things like that. My memory is appalling. And I have spasmodic episodes, which I'm treated for with medication. They can become quite violent. And I get very easily overwhelmed if there are too many people in a room or too many, if I'm in a crowded space. Again, medication is the only option there, or to avoid those situations. Mental health is a point I want to bring up because I don't think it's brought up enough with EDS, especially with consultants. You lose your self-esteem, you lose your self-image. I've lost who I thought I was. You lose your self-confidence, and your friends view you differently, and they see you as just a sick person and not necessarily the person you were. You can have a lack of motivation. I get very anxious about my symptoms, making sure my drinks stay down or my weight is okay, or can I move a hip today or not. I hate feeling like a burden, which I am. I'm a burden on myself, and I feel like I'm a burden on my wife, which is very hard for me to get around. And I feel like I've changed her life and trajectory for the worse as well, which is, again, something very hard to accept. And really fear that my life is this and that it's never going to change from sitting on a chair and dealing with these challenges. Treatment methods, I take antidepressants. That's a more recent thing. I've been fighting them off for years, but I need them. I try to keep a positive mental attitude. Online has been a big way of finding support, predominantly through Instagram, where I've built one-on-one relationships with people with EDS or very rare illnesses, and as a result have one-on-one relationships with them. And further to that, I'm able to call them, meet up with them, and get support from them. The therapy offered here for free by the NHS is very generic and of the lowest quality in terms of counsellors or therapists. They have no understanding of how to support someone with a rare chronic illness other than just saying CBT. And I rely on my wife, and my dog, really, to keep me going. They're my incentives. And lastly, just frustrations, really. There's no stability in any of my symptoms. That's not criticising the consultant. It's the nature of the condition, but it's very difficult. I have a great change in my day-to-day life and my expectations for the future. I'm very scared. I'm also very nervous. There's a lack of mental and emotional support. The GPs offer the service, which is very, very average in my opinion. And if you do need professional help, it comes at a ridiculously high cost. There are support groups, which I've tried, but I have found one-on-one much better than support groups. And just finally, I find there is a lack of understanding amongst the wider population in the medical world, which I know the EDS Society is trying incredibly hard to sort out and give the condition more recognition. So that's me, really. I hope it's been of interest. Thank you very much. And yeah, thank you.